Okay, so we're really pleased today to be joined by Dr. Jo Barton from the University of Essex, who's joined us today to talk a little bit about the connections between nature and health and well-being, the research that's going on in that field, and a bit about how that might relate to care farmers and green care practitioners. So Jo, thanks ever so much for joining us. I'm going to ask if you wouldn't mind introducing yourself, and then I've got some questions for you.
Okay, lovely. Yes, Sophie, thanks ever so much for inviting me along. As Sophie said, my name's Dr. Jo Barton. I'm a reader at the University of Essex. My background is actually in sport and exercise science, but I've taken the opportunity to think about how we can use the outdoors as a vehicle to get more active, partly because I'm very passionate about the outdoors myself, so I'm very fortunate I get to do some research in an area that's really close to my heart, so that's been great.
Okay, great. And can you tell us a little bit more about, how spending time outside and spending time in nature does affect our health and well-being?
Yeah, so I think there's a growing body of evidence that really demonstrates well now that spending time in nature restores our mental fatigue, it reduces our stress levels, it improves our cognitive and our immune function, it enhances our mood, our self-esteem and our well-being. Also, we've got some research that shows it increases our heart rate variability, which is really good outcome, and improves our quality of sleep. So another good thing about spending time in nature is it's more effective at facilitating social interaction, which is really important when we're looking to reduce social isolation. And I think natural spaces also provide opportunities for us to be active, which is really important. They shape our behavioural choices, which clearly has implications for our health and well-being.
Amazing. And spending time outside, that feels like it's just always, everybody knows that that's good for you, but how has that understanding changed over time that, that it is good for our health and well-being?
Yeah, good question. I think people have probably become more aware of the importance of nature contact for health, especially in recent times, actually, during national lockdowns when perhaps more individuals have spent more time outside in their local area. I think people's attitudes are changing. More people have recognised the importance of walking in nearby nature and gardening for maintaining their well-being. However, I would say that this concept isn't new. If we think back, hospitals have always traditionally had gardens as an adjunct to recuperation and healing. Such benefits appear to have been recognised really as far back as the Middle Ages, when they had garden cloisters and vegetable gardens that were used as part of the healing process. In the Victorian period, gardens were routinely located in patients, in the hospitals for the benefits of patients, and actually hospitals themselves were located in pleasant surroundings. I guess some could argue that modern health systems tend to focus on the treatment of disease, perhaps more so than patient comfort and care. So maybe have abandoned some of these useful principles that we knew a long time ago about the importance of nature connection and place. But I do think the view is starting to change again. We are seeing a positive shift in public health thinking and awareness of the importance of nature connection and health. And I guess that is reflected in more recently, the research in this area has started to inform government, public and private stakeholders, all of their approach to policy and planning. So it is important that we are including the provision of inclusive and accessible local public green space with lots of biodiversity, improving the quality of green space, promoting more opportunities for nature prescriptions, where doctors or other health practitioners prescribe nature-based interventions such as care farming for patients living with specific health conditions. So I think there is a recognition that access to nature is really important for our health and well-being, and that is being accepted more widely.
And yeah, that's amazing. So you think that that those attitudes are shifting within the medical profession now as well, with regards to things like care farming and green care?
Okay, so if we focus specifically on medical professional, I think what perhaps was considered a little progressive 10 years ago, there is definitely now a movement towards changing perceptions of medical professionals about the whole value of nature-based interventions for health. I think the recent developments in social prescribing and the growing recognition of green prescriptions is helping to inform and frame those perceptions. And the green prescriptions to nature-based interventions clearly not only provide the patients with the mentally restorative effects of spending time in nature, but also they promote physical activity, which leads to the positive health outcomes. But it's not fully translated into the health and social care practice. I think there's more health professionals at primary care trust level, including GPs, that are starting to work more closely with other sectors to link patients to nature-based interventions, but that referral process isn't yet mainstream. So there are still a number of barriers that we need to address if it's to become routinely delivered. If we were to talk about what those barriers could be, I think the evidence would show is still a lack of practitioner buy-in, lack of knowledge and signposting, and a challenge in changing behaviours of medical professionals. We need further knowledge, dissemination about the effectiveness of nature-based interventions that is based on rigorous research, evidence-based practice, which is all an important precursor to help them make informed decision-making processes. And we probably still need to build on the evidence base regarding what's the optimal dosage, the cost effectiveness, how to upscale, replicate in different types of environments, natural environments, alongside, I guess, understanding the limitations or barriers to success and how we account for different local contexts. I think we can get to a point to then call upon NICE, the National Institute for Health and Care Excellence, to recommend the use of nature-based interventions for health and social care, then that's really going to help raise that perceived legitimacy of such interventions and make it easier for GPs to prescribe. What I would say, though, is that we don't want to just put this onto medical health professionals. We do also need to educate and raise awareness of the health benefits of these nature-based interventions in the general public as well, because that does form part of the problem here. So I guess people who already appreciate the effect of a walk or in a park or a stroll on the beach would readily agree that nature is good for us. But those people who are disconnected from nature may not have had the chance to experience such benefits. And one of the problems in encouraging more green prescriptions is to overcome that patient's perception of whether nature-based interventions are an effective treatment response. And you sometimes find that patients subconsciously believe that taking a pill would automatically make them feel better, whereas leaving their doctor's surgery with a recommendation to engage in a nature-based intervention may not be deemed as effective or even a satisfactory treatment. So it is education and awareness and signposting for the medical professionals, but it's also about raising that awareness in the general population as well.
Yeah, absolutely. You talked a lot there, which was brilliant, about the kind of need for more research, for more rigorous research, and using that as a basis to kind of help shift public perceptions. Is there anywhere that you're excited to see the research go next? You know, are there any new developments? Is there anything that you want to work on? You know, what's happening next that's new?
Yeah, I think I'm probably too excited about doing too many things and then really trying to prioritise what's urgent. So I guess I try and keep it just to 3 key areas. So the 3 key areas from my perspective would be really investing a bit more in the health economic assessment side of it, trying to standardise evaluation frameworks, and then thirdly, perhaps building a bit more on what I just mentioned about addressing those gaps in the evidence base. So if I just say something very briefly about those 3 areas, with the health economics and sort of cost benefit analysis, I think that's really important. Some researchers started to look at the health economics of nature-based interventions, but that is a priority that we need to inform policy decision making. So one of our recent research papers showed that nature-based interventions can improve life satisfaction and happiness, and the margin of change was then converted to represent economic benefit from reduced use of public services. But we also need to consider alongside that the value of the increased wellbeing benefits. So if we could do a much more detailed, accurate cost-benefit analysis, then we can, in effect, ascribe a monetary value to the mental and physical wellbeing benefits. That's going to have much more impact at a government political level anyway. So I think health economics is important. The other issue that we're still developing is about standardising our evaluation framework. So we really, as researchers, need to identify a wider range of outcomes to evidence the sort of potential social and economic benefits, in addition to those health and wellbeing ones that are more well documented. But to enable upscaling at both a national and international level, then there's a need for more consistent metrics and a real standardised approach to the evaluation. So an example could be measuring quality of life would be an excellent tool to use in sort of future longitudinal studies, because that can then feed in and support the economic analysis and social return on investments. And their future research methodologies really need to adopt a common system of evaluation so that the research in different disciplines and different countries can really be evaluated as a body of work rather than a collection of disparate findings. And then the third is about addressing the gaps in the evidence base, which as researchers we're always keen to do. And really the gap still in this area is the need to conduct a randomised control trial to compare the nature-based interventions to alternative interventions, perhaps based in clinical settings, to really help inform the NHS debate on good practice in the treatment of mental ill health. So randomised control trials, more longitudinal studies, and then we've got a better understanding of adherence and longer term shifts in health markers and the efficacy of these sorts of interventions. And alongside that, it's about enhancing our understanding of the underpinning mechanisms. So further research is really needed to understand how the complexities of this human nature relationship works, and therefore how we can optimise it. So that would be my 3 key areas to focus on next.
It's incredibly succinct, and having spent some time reading through a lot of the literature, yeah, I can absolutely agree. I can see how amazing those developments would be. Lastly, I mean, I cannot imagine after hearing you say all of that that you are a person that doesn't like spending time outside. So I just wanted to know, what's your favourite way to kind of spend time in nature and be outdoors?
Okay, well, yeah, okay, so mine's probably fairly simple, I'd say. I absolutely love going on a family walk with my husband, my 7-year-old son, particularly when it's the first signs of spring upon us. You see the sun nudging out from behind the clouds, and you suddenly start to hear the sound of birdsong, and you realise actually how quiet it's been over the winter period. And the snowdrops, daffodils, all poking their heads out of the ground. Days are starting to get longer, and my son is so excited about getting his bug hunting kit out, which is his absolute joy. And I just get so much pleasure out of watching his connection to nature grow as he hunts for bugs, insects, spotting butterflies, stroking worms. Apparently that's key for a 7-year-old. Finding hidden snails and giggling at ladybirds or centipedes as they're tickling his skin as he holds on to them. And that is absolutely guaranteed to bring a smile to my face and just a realisation that all is okay in the world, really.
That's so lovely, yeah, and that takes me right back to being a child and holding ladybirds and being tickled by them.
Yeah, can't beat it, apparently.
No. Jo, that's amazing. Thanks so much for your time. Yeah, and we'll be putting some more videos up as part of this series. So thank you.
Thank you ever so much for inviting me along. It's been great.